to be doing on Miss Jane here is going to be what we call her glabella, which is a combination of 3 different muscles, the corrugators right here and the little procerus. And what that does is it stops these 11s from forming. The other thing that we're going to be working on is a little eyebrow lift for Jane. This is actually an off-label procedure that we do, and what it does is it just relaxes this muscle so that the brow can kind of just pick up a little bit.
What does off-label mean, Dr. Trina?
It means that it's not FDA approved, but it is very standard in this industry to use many different areas that are off-label, so that Botox can kind of give the patient.
Basically, the drug companies just can't talk about off-label areas because they haven't done the FDA approvals for them.
Exactly, exactly. So I'm going to have you make a little angry face, my dear. Perfect, and relax. And I'm just going to give her a little squeeze here. And here we go. 1, 2, 3.
Any pain, Jane?
No.
1, 2, 3. And 1, 2, 3. And guess what? That area is already done.
So that was a complete glabella.
That was, yes. And she didn't need much because she doesn't have a whole lot of movement. These little bumps that she has are totally normal. She does. She makes sure she comes in often. But the little bumps are normal. They'll be there for about 15 minutes. That's just a little bit of the volume of the product, and also a slight histamine reaction. So now we'll do the brow lift. And the way I approach this area is just by going underneath the brow. And this muscle, it's called the orbicularis oculi, and that's what we're relaxing here. So I'm going to have you make an angry face for me. Good, and relax. And I'm just feeling for the muscle here. And 1, 2, 3. And you'll notice this is just a slightly different technique. 1, 2, 3.
And how much of a lift will she get with the eyebrow?
It'll be subtle, but believe it or not, even though the spectrum is wide, it's actually the next best thing that you can do for a bluff for the hooding that's above the eye. I'm gonna have you look straight forward, my dear. And a little angry face for me.
So anybody who's considering that upper lower bluff surgery might want to consider a little Botox first or technology treatments, huh?
Absolutely. I try to always just let people know that we can do things with Botox and filler that can, at least stave off or prevent surgery from happening for some people.